Do you ever think about how many breaths you take per day? Over the course of a day, that adds up to 17,000 to 30,000 breaths per day.
Other people suffer greatly from a simple act of respiration, and not just that, other symptoms like
Severe problems breathing, rash, loss of appetite, night sweats and chills, diarrhea.
other symptoms include
Fever over 100.4 degrees Fahrenheit, dry cough, sore throat, headache, body aches, malaise, and confusion.
it is a respiratory illness that is both contagious and fatal, and can sometimes cause pneumonia. It is called SARS.
Severe acute respiratory syndrome.
From 2002 to 2003, 8,000 people got infected worldwide. The disease was first identified in China in the year 2003 and ended in the same year. The illness spread to more than 2 dozen countries in North America, South America, Europe, and Asia, before the SARS global outbreak of 2003 was contained. There is now no known SARS transmission anywhere in the world. The most recent human case of SARS infection was reported in China in April 2004 in an outbreak resulting. The image in the right hand corner shows you the infection in the lungs.
There wasn't a cure for SARS that immediately cured it, but patients with SARS were given antibiotics to treat bacteria that cause pneumonia, antiviral medications, although how well they work for SARS is unknown, high doses of steroids to reduce swelling in the lungs, oxygen breathing support or chest therapy. And although they were given all these medications, doctors weren't sure if these treatments would work well to cure the disease, but it was the only medication available. Since the year 2004, there has not been any known cases of SARS reported anywhere in the world. The disease has been cured and it does not exist anymore. In order to avoid being infected with SARS, you should frequently wash your hands, avoid touching the eyes, mouth, or nose with unclean hands, and you should always cover your mouth and nose with a tissue when coughing or sneezing. SARS virus is so rare that its diagnosis mainly depends on whether a person has an obvious history of exposure to the virus or not. The virus is mostly contagious during the second week of the illness. Serious complications arising from SARS are most likely to affect people aged over 60 and people with other chronic illnesses such as diabetes or hepatitis. To stop the spread of infection, it is vital that anyone with SARS limits interaction with other people until 10 days after their symptoms have improved. Patients should be placed in an isolation unit. It is believed that SARS is spread through droplets in the air and a close person-to-person contact.
The funds we received will be used for advertising about the diseases and how it killed many. Therefore, raise awareness about how to prevent the disease coming back. The choices you make do not only affect yourself, but also affect others around you. That's why you should be aware of the steps you take in order to forbid deadly diseases and problems from coming back or occurring, before it's too late for us to act upon them and solve them.